Welcome, everyone. My name is David Hirsch. I'm the CMO at LASA Before we get into tonight's webinar, let's just take a moment to acclimate to the webinar room. To the bottom right of the screen, you're going to see two tabs, questions and chat. To connect with other attendees or notify us of any difficulties, please use the chat tab. And at the end of the presentation, we will use the chat tab to post a promo code specific to this event. If you have questions for Shellie, please use the questions tab. Your questions will be used by a moderator at the end of the lecture during our Q&A session. We should be able to get about 5 questions in. We're a little tight on time tonight, but and those might be random. Any questions you guys have specific for Shellie that don't get answered, we'll provide an email address for you to contact Shellie or us. Please note that each webinar is recorded, and immediately following the conclusion of the webinar, you will receive a link to view the video on demand and a copy of the slides. So Dr. Goldstein has been practicing cosmetic facial acupuncture for over 30 years. Today, she is widely considered one of the worldwide experts in the field of facial acupuncture for appearance enhancement. She is the author of Your Best Face Now, Look Younger in 20 Days with Do-It-Yourself Acupressure Facelift, and creator of Touch and Glow, the Do-It-Yourself Acupuncture Facelift Kit. As a leading authority and educator of cosmetic facial acupuncture, Dr. Goldstein founded the Academy of Advanced Cosmetic Facial Acupuncture, which was recently partnered with the Pacific College of Health Sciences to present the Facial Applications of Cosmetic Enhancement Training Program, also known as the FACE program. Dr. Goldstein has been featured on major television and cable networks and in the press. She lectures worldwide and is currently a contributor in Acupuncture Today News. So without further ado, Shellie, take us away and everybody enjoy.
Thank you, David. Thanks so much, LASA for having me tonight. It's always a pleasure to work with you, and thank you. I love seeing everyone's name in the chat. I recognize some of you, so it's very exciting. Today we are going to talk about a very popular topic, facial wrinkles and how to treat them with intradermal needles. When we think about wrinkles, we think about them as just a little crease in the face, and you pop a little needle in and voila, there you go, you treat it. But in fact, that's not the case. We can get wrinkles from a number of different reasons. When you look at the anatomy of the face, as we age, bone changes, bone resorbs, which means that it starts to break down, almost like crumbling from the edges, and the bone as the basic structure of our face, when it starts to change, it affects all of the tissue, the muscle, the fat, and the skin that overlie that bone and creates the appearance of wrinkles. We can get wrinkles from muscle changes. On the face, there's a unique set of muscles called the muscles of expression. They are the muscles that actually create expression when we talk, when we move, when we smile, when we frown. And as these muscles age, they start to attenuate, which means they get a little drier, they get a little stiffer, and they get static, they freeze. And when that happens, the skin that covers the muscle starts to change as well, and we start getting creases or wrinkling on the face. We can get wrinkles from fat changes. As we age, the fat on our face, which creates the roundness or the kind of the appearance of our face, the plumpness of our face. As the fat starts to change over time, it deflates and descends, which means that it breaks up and it starts to move. Some of it moves under the eyes, some of it moves along the jawline. A lot of it moves from the mid-face all the way into the crease between the nose and the corner of the mouth, called the nasolabial fold. A lot of that creasing or wrinkling is due to fat changes in the face. And then, of course, there's facial changes in the skin over time. And that's what we're going to talk about today. We're going to talk about the changes that occur on the skin level that create wrinkles and how to use intradermal needles to affect those skin changes. So I'm not in charge of the slides right now, so I'm just going to wait and they're going to change. So, all right, so the top part of the skin, the integumentary system, is made up of the epidermis, the dermis, and then there are deeper layers called the subcutaneous or the hypodermis of the muscles. So when we talk about intradermal needling, we're really talking about that epidermis dermis layer. The cells of the skin start at the base of that dermis layer, right above that little yellow area, and they start to grow. They start to move up towards the top of the tissue. And as they move up through that dermal layer, this is when they maintain their health, their integrity, and developmental stages. And they move up into the dermal layer. As they reach the dermal layer, they begin to flatten and dry and lose their vitality. And then they slough off, and then the base layer cells start to come up again. So this epidermal dermal layer is really what we're talking about when we talk about using intradermal needling. These are the layers that we're starting to affect. And what we're affecting is the integrity of that tissue. And we're going to find out how we do that. Okay. Intradermal needling. So when you think about needling a hypodermic syringe, intramuscular needling is when the needle goes at a 90-degree angle into the muscle. Sub-Q or subcutaneous needling is the angle of the syringe is at a 45-degree angle with the intention of injecting whatever solution is in that needle into the sub-Q or that fat layer. Intravenous needling is when you're actually directing the fluid into the veins or the vessels. And then there's intradermal needling, which is really going into the between the layers of the epidermis and the dermis. So when you to the right, you see the needle too deep because it's going into the sub-Q or the subcutaneous tissue. If it's too shallow, then it just hits the upper epidermal layer. The inserting it properly is actually going right into the dermis. Now, why is that important? Why are we going into the dermal layer? Why is the affecting the integrity of that tissue in those layers preventing or stopping the growth of wrinkles? And here's why. What we're looking at is the relationship between the tissue and the connective tissue. So there are two different layers of tissue in this area. So the area in green is the area that we're affecting with our intradermal layers and intradermal needling. That top layer is called the papillary layer. And the papillary layer, as you can see on the right, it's it's a very loose connective tissue, whereas the reticular layer is the deeper layer, and that's a much more tightly bound layer. Can we have the next hit on that slide, please? Okay, so you see the papillary layer is that loose meshwork of thin connective tissue. It's very loosely wound. It provides the nutrients to the skin, whereas the reticular layer is a much more dense layer. Can we see that, please? And it's designed to provide the strength and the structure and the elasticity. What they both have in common is that they're a form of connective tissue. Next slide, please. The connective tissue is made up of certain components. The first component is collagen. Collagen, can I have the pop-ups for those, please? The collagen is what provides the support for the cells. So for example, think of it like a mattress. The mattress is nice and plump and thick. And over time, as we lay in that mattress, it starts to flatten and divot into the center. That's collagen. It's the plumpness, it's the structure that we need in order to maintain a plump layering of connective tissue in the dermal layer. And then we have in the connective tissue, we have elastic fibers or elastin. And that's what provides that snap, the snap back of the tissue over time. So for example, if you take a little piece of skin from your hand and you lift it up and you drop it, the rapidity or the ability for that skin to snap back to its original shape after being pulled is what is due to the elastin fibers. And then you have fibroblasts. And fibroblasts are what they're cells that are stimulated to produce the collagen in the tissue. So fibroblasts get stimulated, and when they start to multiply, they will then stimulate the production of collagen within that tissue. So fibroblasts are the first line of defense. And then all of these, the collagen, the elastin, and the fibroblasts are all bathed in hyaluronic acid. And hyaluronic acid is the moisture that keeps everything hydrated, plump, and maintains the moisture both within the tissue and on the surface of the tissue as well. Now, the next slide. When we, over time with age, there obviously are changes. And when we see, what we see is over time is that in the skin, the tissue on top tissue, the dermis and the epidermis, we see in the dermal layer a decrease in cell health and cell turnover, which leads to that the lining up between the epidermis and the dermis that starts to get thin, dry. There's a disorganization of the collagen fibers in that dermal layer. What happens then is you get a reduction in vascular tissue, and all the tissue starts to die. The dermal layer, the epidermal layer, that whole tissue layer starts to dry out, die. And then we see on the surface, because the epidermis is what you see when you're looking at the skin, on the surface is where we see the effects of what's going on underneath. And what we see is this divoting or pitting and leading to wrinkles on the surface of the skin. Can I have the next slide, please? So when we talk about wrinkles, there are multiple types of wrinkles based on, and right now we're just primarily focusing on the wrinkles in the dermal layer and the epidermal layer of the skin. So we see fine lines. Fine lines are not wrinkles. They really are just very, very fine hashtag lines. And usually people have them all over their face, not just in one area. And it's mainly because they're dehydrated. Their skin is dehydrated. It's like the desert. It's starting to dry out, and you're starting to see little cracking on the surface of the skin. That's not a wrinkle. The three types of wrinkles that we're going to focus on today are shallow wrinkles. And again, we're looking at in terms of aging and in terms of degradation of the integrity of the dermal layer and the epidermal layer. So the first is the shallow wrinkling. And this is when that elastin and collagen are just starting to weaken. So when someone is in a resting state, you may not see it, but when they're either lifting their eyebrows or making a gesture, you might see that. But it's not related to the muscles. This is related specifically to skin. And then you have a deeper wrinkle, and this is skin that's creasing because of the increase in the tissue integrity of collagen and elastin. It's a little bit older skin. It's not just weakening, but it's starting to break down. And then you have static wrinkles, and these are for people that are older. These are visible even in a resting state, and we're going to show you a picture of them as the three different types. And then you have dynamic wrinkles or rhytides, and these are mainly due to muscle movement, particularly those of the muscles of expression. So that requires a different type of needling other than an intradermal needle. Can I have the next slide, please? Okay, here we go. Look at the pictures on the left, and they're running from top to bottom. So you have a frontal view, a three-quarter view, and then a side view. So shallow wrinkles are usually younger people. It usually starts around between the eyebrows, around the corners of the edges of the mouth. It's smaller wrinkles. They come, they go. They're not always there. Whereas a deeper wrinkle would be more indicative of, say, the face in the center, where you can see the person is a little bit older. You can see particularly beginning right at the inner canthus of the inner eyebrow of the eyebrow. You can start to see a little creasing that's going on in there. It's right in there. And then between the nose and the mouth, that's another area that you might see it. And then a deeper wrinkle would be more the person all the way to the right. They're static, stay there. You can see them all the time. It doesn't matter whether the face is in a resting or an active phase. So the nasolabial fold, the fold between the nose and the corner of the mouth. Between the eyebrows, you can see that hard, deep creasing that occurs. A lot of times you'll see it at the sides of the eyes, under the eyes, or between the mouth and the corner of the jaw, which is known as the mental crease or the marionette lines. Next slide. This is a good picture of what happens when collagen in the deepest stage, in the static stage, where you have wrinkling due to degradation and loss of collagen in the face. So you can actually see in these areas that are lined, you can see the collagen or the tissue is actually really depleted. You can see it flattening, you can see it divoting, and it gives the appearance of wrinkles. So you're going to treat this a little differently, obviously, than a wrinkle that is more superficial and more shallow. Can I have the next slide, please? What's interesting about this is this concept of needling more shallowly and deeper depending upon the layers of the skin actually is in the Ling Shu. In the Ling Shu, it talks about different techniques for needling. And I see the next part of this. And throughout these ancient texts, there are actually a number of different discussions about needling guidelines specific to the layers of the skin, the flesh, the area between the flesh, which is the connective tissue, in the channels and around the muscles and at the level of the bone. Next slide, please. And keep going. You can pull everything up. Okay, so in the Ling Shu, it says the skin, the flesh, the muscles, the tendons, and the meridians occupy different places in the body, and that different diseases respond to different methods of treatment. Again, they're talking about different ways of needling. If illness is superficial and needling is deep, it will penetrate and injure the good flesh. If illness is deep and needling is superficial, results will not be obtained. Next slide. So you can see that there is clearly throughout history different ways of needling dependent upon what you're trying to achieve. So for us, intradermal needle is very similar to Japanese needling. For those of you who prefer Japanese needling to more Chinese needling or actually use more Japanese style treatment, you know that the needles are inserted very superficially into the surface of the skin, that the manipulation is performed at the surface of the skin. And the object is not to stimulate DACM, which we're not doing when we needle the face. The needle gauge is thin and the range is also thin. So next slide. So you're using very thin needles, short needles. And when you look at the research of why this works, one of the theories, which I think is a very good one, is that when you insert a needle into the surface of skin, it creates that natural wound healing cascade. So we talked about the fibroblasts, we talked about collagen, we talked about elastin. When you insert the needle into the skin, what you're doing is you're tapping in to the body reading trauma. The body reads trauma, fibroblasts start to activate, collagens, and the fibroblasts create collagen. And you can actually see in the image how the thickening of collagen actually begins to resupport the tissue and actually make it thicker and more and provide more volume from underneath. That's what we're trying to do. And then in doing so, we're creating more elasticity, thickening of the skin, kind of filling in what we can see as and call wrinkles. Next slide. There's something else that's going on too, and you can please bring up all the parts of that slide, please, the next two parts. What's happening is not only are you creating that trauma, that natural healing cascade, but you're also tapping into the production of collagen. And remember, we said that collagen is the primary component of connective tissue. And it's also capable of transmitting electrical signals throughout the body. It's called collagen piezo-electricity. When you stimulate collagen or when you tap into that collagen, the fibers actually have mechanical and electrical properties that radiate or resonate throughout the tissue. So this is partially how acupuncture works. You insert a needle into one area and it vibrates and resonates throughout the tissue at more local and more distal sites. When altered by external influences, an acupuncture needle, the electrical current within the tissue causes a physiologic response that extends into neighboring structures. So you put the needle in, you're creating the piezo, you're tapping into the collagen, and that collagen creates that electrical current. It starts transmitting those signals throughout the body. Next slide. So we use our intradermal needles. We stimulate, insert it into the tissue. We stimulate that wound healing cascade. We excite the collagen piezo-electricity, and we can also release fascial tissue. Because when you think about wrinkles, they're not all the same. And you can see in these different slides, these are histological stains, which means that they scrape a piece of tissue, put it on a slide, put another slide on top, put it under a microscope, and take a look at it. So that's what you're looking at here. In A, you see that the wrinkle or the surface of the skin divots a little bit and comes back up. So this is how we would perceive a wrinkle, the little creasing in the tissue. B, there's not much of a, it's much more superficial, much more shallow compared to, say, look at D. D, they're deeper wrinkles. So when you're looking at them on the surface of the skin, it's hard to see what you're really looking at. But under this histological slide, you can actually see that each of these different stains present a different depth in terms of wrinkling, and we're going to treat them a little differently too. So let's take a look at that. Can I have the next slide, please? Okay. Up until now, we haven't had too many choices in terms of needling options. So remember, we're going to put the needle in, we're going to angle it at either approximately a 10 to 15 degree in order to get either into the crease, into the wall of the crease, or all across the crease itself. So we've had the straight intradermals that we've primarily used with the tweezers. They go in horizontally. They're Japanese needles primarily, or you have the vertical insertion of the press tacks as two options. They're okay, but I've always been a little frustrated by them for multiple reasons. Can I see the next slides? Yeah. Yes, so here are the serums. These are the ones that you use with the tweezers. Next one. Next, yeah. And then DBC makes intradermals too. But either way, you have to take a pair of tweezers and you have to slide it in. You can get there, but you don't have the depth of control that you really want. Next slide. And then the problem with the press tacks is they just go straight in. So a lot of times I know that the Pinex has the little tape that goes on them, so it's really hard to really calculate where you want it to go and how you want it to work. But now, can I see the next slide? The new needle is out, and LAS is just starting to launch it. It's called the Serum L.Acs. And what's really great about these needles is that they come in different lengths, different thicknesses, but they're all really thin, and you can actually hold on to them. The plastic part is kind of flat as opposed to round. You can actually angle it, slide it, and direct it in whatever direction you want. Like the Serum needles, they are triple polished. They are cleaned with ultrasound and baths of alkaline, acid, and water to remove the foreign substances. They're just, the integrity of Serum needles are just amazing. As usual, these are the same. They actually come in 4 needles per blister pack. I made a mistake, and we're gonna let me just show them to you. Can I have the next slide? Okay, this is a video. Can you play the video, please, Stephen? And so here are the needles. You can actually fold them back and put them on the table, and you can lift them up. You can actually see this is a red-handled one. This is in the middle thickness, middle length, but it's they're easy to use. They're super thoughtful in terms of how they design them. And so let's look at how we would needle with these. Let's go. Can we see? Okay, so this is a video. This person, we're going to needle in the forehead wrinkles. She's very, these wrinkles aren't there all the time. I know this person. So And this looks a little blurry to me. Can you play that again? Yeah, so what I'm doing is I'm pulling the needle apart, or pulling the skin apart one more time. Can you play this one more time? Yeah, so I'm going to open the tissue. Yeah, spread it open and then insert the needle. So you take your fingers on it, you spread the area to make it nice and flat, and then insert it. Can we is that clear? Okay. And the next option is to, for say, treating more deep or static needles, is to not just spread it, but to actually grab the tissue and go ahead and do the, go ahead and, yeah. So what you're doing is you're grabbing the tissue, pinching it, and then inserting the needle. Can you play that one more time?
Just as he's doing that, we're going to make all these videos available after the webinar. So we are quite a number of people on the webinar. It tends to slow us down a little bit. So all these videos will be accessible.
Okay, so you pinch, push it open, and if you play the second one, you'll actually see it a little bit more. You're pinching the tissue, popping it open, right? And then you're going to take the needle and you're going to go in. And so for this, of the needles, I would actually, the L.Cs, I would use a little bit longer one. So you pinch it, open it, and then slide it in. Okay, next. Now, we talked about the shallow needles. You're going to spread it open and slide it in. And then we talked about the deeper wrinkles where you actually pinch it, say in the nasolabial fold, you're actually going to pinch it and slide up. And then there are static wrinkles. The difference between static wrinkles is because they've been around for so long, because there's generally older, more aging skin, it's going to start acting like scar tissue. So scar tissue is composed of the same collagen protein as the healthy skin tissue, but the fiber is a little bit different. So you see in this image, the healthy tissue, it's nice and striated and horizontal collagen fibers. And then what happens is, as it gets damaged, it starts to break. Now, this damaging can come with age, but it can also come from any type of damage too. So for most people, it's related to age, and the tissue has just gotten tough and solid, and it appears to be like scar tissue, because you can see in this one the scar tissue. So as the tissue starts to get solidified or get damaged over time, it starts to look like this. If you were to just open the skin and slide it across, you're not going to make a difference in it, because what you're not doing is addressing the scar tissue or the damaged tissue. If you pop it open and go into the center, you're not going to get it as well, because again, you're just going into the depth of the valley of the wrinkle. What you actually need to do is go into the scar tissue or go into the tissue. And so the object is to actually needle either from the outside, and we'll look at this in the next slide, please. Okay, so here you go. So you can actually see, here's the different types of scar tissue, and you can actually see the dark area. This is the changes in the tissue around the wrinkle. So again, when you needle, you actually need to go and break up the tissue that surrounds the wrinkle itself. So if you go into the wrinkle, you're going to miss it. You actually need to break that up. So can we see the next slide? Okay, so this is it. So this wrinkle is the one that we're looking at right here, the one I'm in the upper corner, and you can see it's right at the end of my finger, and you can actually see that this wrinkle starts below and goes all the way up into her lip. So this is a very long, very deep wrinkle, and the basic trauma is right here. You can actually see how much thicker this area is than, say, this. So this wrinkle actually comes to the surface more above, and then below it's pretty thick. It's pretty damaged. The tissue around it's pretty damaged. And you can actually see when you look at this entire chin area and a lot of the wrinkling around the lip. These wrinkles are old. There's tissue damage around them. So just needling into the center of it isn't going to do it. So can we see the video of how we do this? Yeah. Okay. So what I'm doing is I'm grabbing it and I'm needling into the sides of it. So on this needle, I've actually needled from the outside to the middle, and then again from the outside to the middle, with the intention of actually going in and trying to break up the scar tissue that surrounds this needle, that actually locks the crease into place. Next. Okay. So just to recap, if it's a fine line and it's very small creases in the skin surface, a lot of it is dehydration, and the treatment is just to enhance or drink more water. Shallow wrinkles that are more thin, that are just starting to come up, spread the wrinkle, needle into the crease. If it's a deeper one, it's caused by a decrease in tissue integrity. The skin, the collagen is starting to break down. And then in order to treat that, you actually need to squeeze it, lift it, and needle into the crease. And then if it's a more static wrinkle, what you want to do is you actually want to needle into the wall to break up the damage. And then for more dynamic wrinkles, this is different. This is actually related to facial movements and muscles of expression. And in that case, you're going to actually need to treat the wrinkle plus the muscle layer, and that you're going to do with intramuscular needling and different needle sizes. Okay. And so if you want to learn more, I have partnered with the Pacific College of Health Sciences. We offer a 100-hour training program. It's a combination of virtual learning plus hands-on clinic and then case studies. Next slide. And what's nice about this class is that we have a number of different teachers who are leaders in the field, such as myself, Matt Callison, Yuling Lee, Christo Miss, Michelle Gellis, Deirdre Courtney, Carrie Hart. All of these bring their levels of expertise for different areas. So it's one huge class with different teachers. And then for those of you, next slide, who are going to be at the Pacific Symposium, we'll be there too. So hope to see you there. And again, thank you, David. Thank you, Stephen. Thank you, Lhasa, for having me here. If you have any questions that we don't get answered today, you can contact me at either info at hamptonsacupuncture.com, or through my website, or through Instagram at Shellie Goldstein. And I am so sorry about the bell. There's just a lot of chit chat going on in my family. Sorry.
Thank you so much, Shellie. This was amazing. We have plenty of time. We have a number of questions. I think we should be able to get through most of them. Feel free to keep posting any that we don't get to. Again, we'll get them answered. An early question, Shellie, what are the general ages of the people in the pictures?
Okay, that's a good question. And remember, age is just a number, right? Because you can be older and have taken amazing care of your skin, and then you look younger, or you can be younger and really torture your skin and then look older. But in general, wrinkles start to develop, fine lines and wrinkles start to develop in the early 30s. And then in your 40s and 50s is when they start becoming static. And then after that is when, or becoming deeper, and then they start to become static later in life, say in your 60s. No.
Next question, do collagen supplements really help with facial anti-aging or not?
Well, if you can read the research, it's all over the place. Some people say that the actual proteins themselves are too big to actually be absorbed through the gut lining and to be effective. However, I take collagen on a regular basis, and when I stop, I can actually see the difference in my skin. And when I start again, I notice that it improves. So from a clinical perspective, I would say absolutely it works. And from a more in the literature, it's going to be mixed. But in my own opinion, in my personal opinion, I think it really does. But it has to be a good source. So I think Vital Proteins is a really good source. You can even get it at Costco.
Shellie, which book is being referenced for Ling Shu, if you know that?
I have an old copy of the Ling Shu. It's actually typed, and so I found it in there. I don't know which version it is.
Lengthier question. Is it safe to say that all acupuncture methods stimulate the wound healing cascade, or only at certain levels of integumentary system?
Integumentary system. Yeah. So when you put a needle into the skin, you stop within the dermal layer of the skin, you are starting that cascade. And the body reads it as a trauma. It's like, so a really good example of this is microneedling or derma rolling. You have the little wheel, you roll it over the surface of the skin. The intention of that is to actually create that micro trauma into the surface of the skin to stimulate the fibroblast activity to rebuild collagen, thicken the tissue itself.
Shellie, how do you determine if the needle is the correct depth of the dermis?
This is when you are spreading. Remember that the layers of the tissue on the face is very shallow. And press on your forehead, and with very, very light pressure, you are actually going to be touching bone. Right on the cheek, it's a little bit more. There's a little bit more tissue there. So when you are angling, first you're going to angle at a 10 to 15 degree angle, and you should actually be able to, I'm going to just use my hand. You insert the needle, you should actually be able to lift the needle like this, and the skin will come up. If you are in a little too deep into the muscle layer, if you lift, you're not going to see much on the surface. Also, if you are in the muscle layer and you push, you're going to get the muscle to twitch a little bit. So you want to be above the muscle layer. You're going to be going at a 10 to 15 degree angle, and then you can actually just lift slightly, lift the needle slightly, and you should actually see it rounding up under the surface of the skin. It was actually in one of the slides. When the needle was in, it actually caused a little hilling on the surface of the skin.
Shellie, do you use a laser after needling or put any electric on the needles?
On the face, I do not. I do like microcurrent, but I don't do it on the face with an e-stim, mainly because what you want to do with electricity is actually stimulate the muscle to help itself, as opposed to fatigue the muscle that would occur when you're using e-stim.
Okay. Great question from Nicolette. For middle-aged people with mild, moderate wrinkling, what might a treatment plan look like? As in, how many treatments would you recommend? How often?
That's great. I would mild to moderate. Well, the great part about treating someone with facial acupuncture is you have them come in weekly for at least 10 treatments, so you can treat them weekly. The other thing that you can do is send them home with a home derma roller. A derma roller is, for those of you who aren't familiar with it, it's like a little wheel that has little needles that come out, and you just roll it on the surface of the skin. You can do that every other day. Remember, however, that the healing comes not in the needling, but afterwards. It's the ability for the fibroblasts and to rebuild the collagen in the surface of the skin. So you can needle once a week in office. You can send them home with a home derma roller to do every other day. You want it to be fairly shallow in the needle itself on the derma roller, again, because we want to go into the epidermal and dermal layer, not much deeper. And then you'll see a difference within a couple of months. Well, you'll actually see a difference within the 10 treatments, but then a more significant change over the couple of months.
Okay. Shellie, whether it's L.Ps, needles, or not, what different gauges do you recommend based on the number of wrinkles or what have you?
Yeah. When I was using regular needles, the Serum needles, I was using 42 gauge of the Japanese. Now I'm looking at these L.Ps right now. I have some boxes right here. And I actually like the dark green one. It's 0.12 times 7 millimeters. It's an O2. I like that one a lot. And I like the red ones too. They're a 0.1. So they're numbered. They're numbered 1, 01, 02. I would say play around with them. These needles are designed for intradermal needling on the face. So anything within that range is going to be fine. And it's really just a matter of personal opinion. Some people like thicker needles. Some people like thinner needles.
We have quite a number of questions around facial acupuncture on people who are using Botox. Your thoughts on that?
Yeah. Ask every facialist acupuncturist and you're going to get a different answer. So some people will say you can't treat people who've had Botox. Quite frankly, for me, I wouldn't have much of a practice if I didn't, because a lot of my patients have Botox. My feeling about it is if you wait the window, it's a 10-day window between the time that they get it, the Botox, and the time it actually starts to kick in. You don't really want to needle in between that time, mainly because the intention of the Botox is to stop the transmission of activity from muscle to muscle. So you don't want to spread it so that it's affecting muscles that you don't want to spread into. So say, for example, the papillary muscles on the top of the eye, you don't want Botox to go there because then the eye's going to droop. So just avoid it for 10 days. And then after that, you can start needling, and it's not a problem. The only thing you need to be cognizant of is that acupuncture will help to bring back the activity of the muscle. So it's going to take away from the effect of the Botox. That being said, hopefully, by the time the Botox wears off, you've actually made a bigger difference, and so that the creasing is not there. Okay. But it's a conversation you should have with your patient.
Shellie, could you speak to keloids? Can they be treated with intradermal needling or microneedling? They
can. You need to treat them as if they're scars. Remember, it's tissue bunching. So you actually need to get in there and break up the damaged scar tissue that creates the keloid.
A couple questions around the amount of time per treatment, how long you leave needles in and such.
Yeah, I tend to leave them in between about 30 minutes. Some people, when you're treating with facial acupuncture, it's no different than when you treat with body acupuncture. And some people can take nice long treatments, and some people after 10 minutes are getting a little bit antsy. So you're going to treat your patient in the same way that you would treat them for other things as well. When they are starting to get edgy, then you might want to take the needles out. Some people just conk out and really enjoy it for a very long period of time. So again, be aware of your patient's cycles, and you treat them accordingly.
I think that is it. I may have missed one or two. If you did not get your question answered, please email us at marketing@lasaoms.com. Shellie, thank you so much for this. This was amazing. We will post this webinar. So several of you have asked on our blog. You'll see some emails come across. I think we posted a promo code in the chat. We have a needle sale going on right now, so stock up on your Serin and other needles and other supplies at loslms.com. And we will look forward to seeing some of you at PCOM. Everybody have a wonderful evening. And Shellie, thank you again so much.
You're so welcome. Thank you. And thank you for having me. I appreciate it.
Have a good night, everybody. Thank you.
Bye.